everyone. Welcome to today's episode of Licensure Hub. If today happens to be the first time you are joining us, I will urge you to subscribe to our Licensure Hub channel so that as and when we release any new video, you will be notified to follow us accordingly. Our question for today begins, and it reads, Kwesi Akroma has the impression that he is developing cancer. Which of the following warning signs would prompt him to seek medical care? I. A sore throat that does not heal. II. Frequent diarrhea. III. Indigestion or difficulty in swallowing. IV. Unusual bleeding or discharge. Looking at this question, we have to quickly remember our previous knowledge on neoplasms. A neoplasm, which simply means a new growth which can be benign or malignant. The question was saying that the patient feels he's developing cancer. What are some of the signs, the warning signs of cancer? A warning sign of cancer can be given with an acronym called CAUTION. The 7 warning signs of cancer can be given with the acronym called CAUTION, which is projected on your screen, where the C stands for change in bowel or bladder habits. A stands for a sore throat that does not heal. U stands for unusual bleeding or discharge from body orifice. T stands for thickening or lump in breast or elsewhere in the body. I, indigestion or difficulty in swallowing. O stands for obvious change in wax or mole, and N stands for nagging cough or hoarseness. And so with the question projected back on the screen, you will see that you need to remember these warning signs of cancer in order to select your correct answer. So having the caution at the back of your mind, let us apply this over here. Option I, a sore throat that does not heal, is relevant as a warning sign. II, frequent diarrhea. Frequent diarrhea is not one of the warning signs of cancer. And so our option II is out of our answer. III says indigestion or difficulty in swallowing, which is also a relevant warning sign of cancer. And the option IV says that unusual bleeding or discharge, which is also a relevant warning sign of cancer. And so looking at our options, our correct answer will be option B, III, and IV. And so when you want to remember the warning signs of cancer, just remember the word caution, CAUTION, and you are good to go to answer your question. The 7 warning signs of cancer given with the acronym CAUTION should help you in answering this question on your screen. And so our correct answer is the option B. Our next question reads, following a subtotal gastrectomy for cancer of the stomach, the patient develops dumping syndrome. The nurse will explain this to the junior nurse as A, rapid passage of osmotic fluid into the jejunum. B, buildup of feces and gas within the large intestine. And C, nausea due to a full stomach. Before one needs to answer this question, one needs to understand what is meant by the term dumping syndrome and what condition is this mostly seen in. Dumping syndrome is a syndrome in which there's a rapid movement of stomach contents into the small intestine as a result of what? A shortening of the digestive system tract. This is mostly seen after someone has undergone a gastrectomy, either a subtotal or total gastrectomy, where a portion of the stomach is removed and anastomized or joined to a portion of the small intestine. And so when you go back to peptic ulcer, the type of surgery done for peptic ulcer which include the Beirut 1 and Beirut 2 operation. In the Beirut 1 operation, you realize that the stomach is being cut and joined directly to the duodenum. That is Beirut 1. And the Beirut 2, the greater curvature of the stomach is cut off and anastomized straight to the jejunum. That's the difference between the Beirut 1 and the Beirut 2 operation. In all this type of operation, one of the complications that comes with it is dumping syndrome. Let's take a look at in our normal setting. You realize that when the digestive system is just like a tube, a pipe tube, when you cut a pipe tube and join it again, you realize that the length of that tube will be shortened. So coming back to the digestive system, you see that the digestive system is also like a tube. And so when we go and cut a portion of that digestive system off and join it to another part, we are going to shorten the length of it. And when we shorten the length of it, if it takes about 10 minutes for food to move from the stomach into the small intestine, when you go and cut that part of the stomach off and join it, you have shortened the length. And so the time it will take will also be reduced. And so it will not take us that 10 minutes that it normally takes us, but now it will reduce to maybe 5 minutes. That is what dumping syndrome means. Because they have shortened the length of the digestive system tract from the stomach to the intestine, the movement of food becomes rapid. And that's what we mean by dumping syndrome. And so dumping syndrome is just a rapid movement of stomach content. It can be food, it can be water, directly into the small intestine at a faster rate. That is what dumping syndrome means. One may ask, how is dumping syndrome treated? When the patient tells you he feels dumping syndrome, one of the ways to relieve it is by asking the patient to lie down immediately after meals. This will help slow down the movement. So per this explanation, let us look at the question again on the screen. A says that rapid passage of osmotic fluid into the jejunum. B says that there is buildup of feces and gas within the large intestine. C says that there is nausea due to a full stomach. So per all this our explanation, you will see that our right answer will be the option A, rapid passage of osmotic fluid into the jejunum as our correct answer. Our next question. Which of the following is not a precipitating cause of hemorrhoids? A, constipation. B, occlusion of arterial blood supply to the rectum. And C, prolonged sitting and standing. This question takes us back to hemorrhoids. Hemorrhoids can also be known as medical piles, which in our common language we call the koko. What are hemorrhoids? Hemorrhoids are just defective valves at the anorectal region. We have something we call varicose veins. Depending on where the varicose vein is occurring, its name is given. And so if a varicose vein is occurring at the anal region, we term that as hemorrhoids or medical piles. In medical piles, we have specific causes of hemorrhoids and we have the precipitating factors. How will I remember the specific causes of hemorrhoids? It's given with the acronym HOD, which you can say head of department. So to remember the specific causes of hemorrhoid, the acronym is what? HOD, where the H stands for hereditary, the O stands for occlusion of blood supply to the rectum, and the D stands for defective veins in the anal region. These are the specific causes of hemorrhoids. But the question is asking us about the precipitating factors. So looking at this, our odd one out will be the option B. Occlusion of blood supply to the rectum is not a precipitating cause of hemorrhoids, making our option B the correct answer. Mr. Kwesi Adom has been diagnosed with chronic prostatitis. Which is the preferred antibiotic agent or class for Mr. Adom's condition? A. Penicillin. B. Fluoroquinolones. C. Tetracycline. One may ask, what is prostatitis? In one of our previous episodes, we saw the prefixes itis, where we said that itis simply means inflammation of something. And so linking the prostatitis is just the inflammation of the prostate gland. Now, when this happens, various classes of antibiotics can be used to treat them. However, the most potent that can work on chronic prostatitis, or the first line of treatment, is the fluoroquinolones. Example, the ciprofloxacin, the levofloxacin. These are the fluoroquinolones. They are best used to be treated when one has chronic prostatitis. Why? Because they are one of the antibiotic classes that covers a wide range of organisms that causes prostatitis, which include the Escherichia coli, which is the E. coli, or the Klebsiella species. So fluoroquinolones are shown to have a potent efficacy effect on the organism that causes prostatitis. Hence, studies have shown that they are the first line of treatment when one has chronic prostatitis. In addition, they also have a very potent pharmacokinetics in respect to these prostate tissues. And so they are best known to be the first line of treatment when one has chronic prostatitis. Today comes to the end of another episode on our Licensure Hub channel. I will urge all who just joined us to subscribe to the channel, like and share, so that anytime we release a video, you will get notified. You can keep your questions in our comment section and we will respond to them appropriately. Thank you. See you on another episode of Licensure Hub. Bye.